The next case is a 51-year-old female who presents with a complaint of cut on her tongue. Clinical examination reveals a 3 into 4 millimeter stellate-shaped ulcer along the dorsum of the tongue with bilateral cervical lymphadenopathy. Her blood pressure is 151 by 93 and pulse is 80. Now the question is, which is the most likely cause of the presentation? Is it basal cell carcinoma, Gardner syndrome, Hodgkin's lymphoma, or tuberculosis? So let's find out. Now, one of the options was basal cell carcinoma. Basal cell carcinoma is a form of skin cancer that can impact the skin, the lips, okay? Remember, the primary risk factor for basal cell carcinoma is exposure to UV radiation, and it is exceedingly uncommon for this to manifest on the tongue. So, this is not the right option. One option was Gardner syndrome. Now, Gardner syndrome is a hereditary condition which is characterized by formation of multiple polyps in the colon, as you can appreciate here. Now, this syndrome presents various oral manifestations like epidermoid cyst, supernumerary teeth, skull osteoma, odontoma, but it is not related to tongue lesion, so this is also not the right one. Then we have Hodgkin lymphoma. Now, as you can see, Hodgkin lymphoma is a malignancy of the lymphatic system where you have painless, firm enlargement of the lymph nodes. So, we see painless, firm enlargement of lymph node. Along with that, you have fever, malaise, and anemia. In this case, bilateral cervical lymphadenopathy is observed, but there is no systemic symptoms like fever or anemia, so this is also not the right one. Finally, coming to tuberculosis, which is the right one. Now, tuberculosis is caused by Mycobacterium tuberculosis, which affects the lungs. Okay. In tuberculosis, we have regional lymphadenopathy. Apart from this, we have oral manifestations also. Even though it is rare, we can see a stellate or star-shaped lesion on the dorsum of the tongue, which is the most common manifestation of tuberculosis. So remember, the most common oral manifestation of tuberculosis is stellate-shaped lesion. There was one more clue in our case that the patient was an immigrant from Africa. Now, World Health Organization identifies Africa as the region with second highest incidence of tuberculosis. So that should also guide you to the right answer, which is tuberculosis. So D is the right option. See you in the next one.